Did you get your post-op prescriptions yet?
Pre-op nurse Lenike Alexander finds it easy to empathize with her patients and their health struggles. For 2 years, she tried to convince her doctors that she was sick.
I would go into the physician's office and I would tell them, I'm tired, I have no energy, I have these sores that are coming up that are draining, or I would have hair loss, I had this butterfly rash. And they would run blood tests and nothing was coming back specific.
It turns out Lenike had lupus, an autoimmune disorder that affects over 250,000 people in the United States.
The pain was incredible. I mean, it was unbelievable. I would be doubled over in pain from my abdomen, from the lupus.
It's like your body is allergic to itself. Now what that means is your normal tissue is being attacked by your normal immune system.
Lupus is difficult to diagnose because it can develop gradually over many years and attack any organ in the body, including the skin. It took 5 hospitalizations and a full-blown attack called a flare before Lenike was finally diagnosed.
And when you have a flare, it's difficult. You hurt, but you don't look bad. And that's the frustration with the disease. And for me, it cost me my marriage. And I'm not the only person this happens to. People with autoimmune diseases, this is a casualty of having the disease.
Left untreated, the havoc that lupus gives rise to can be life-threatening.
Sometimes they come on very fulminantly all at once, and you have a rapid decline, bad joint pain everywhere, your heart's inflamed, your lungs inflamed, your kidneys are inflamed, and those people really don't do very well. If you can make a diagnosis at your first presentation to the doctor, you're usually very sick.
Interestingly, 90% of those with the condition are female, the affliction being the most debilitating during childbearing years.
We know that women with lupus, when they get pregnant, actually oftentimes get worse, and that there are different things that can happen during pregnancy, which of course is a hormonal event. And so consequently, it probably is more the hormones that causes it to be more common in women than in men.
Lenike still has bad days, but is determined to lead a full life. When she first decided to aggressively pursue a routine of rowing, it worried her doctor. But she credits the sport with helping her rebuild her strength.
It just gives me such a positive feeling, which even days when you're really tired and you think you can't even pull an oar, going out and doing it, the satisfaction. It gives me self-worth. I feel like I have some control of my disease process in my life. It helps me fight the disease. It helps me mentally, which is very important in fighting lupus.
For WebMD, I'm Damon Maharg.